Waldrup, speech-language pathologist and a program director of child apraxia treatment here at the Once Upon a Time Foundation. I'm excited to be here presenting this webinar series in collaboration with the SATB2 Gene Foundation. The SATB2 Gene Foundation conducted a survey of their families to identify needs and concerns, and a frequent concern was around communication breakdowns and negative behaviors. I hope that through this short webinar, I can provide you with a different way of thinking about behavior, as well as some tools and resources to help you and your child or loved one work through some of these difficult situations with greater ease. So you might be thinking, why is a speech-language pathologist discussing behavior? And that brings me to our first big point, and that is behavior is communication. So rather than thinking about behavior or a certain behavior as good or bad or negative or positive, I want us to try to think about the behavior as communication and what is this individual trying to communicate. Now sometimes it might be unintentional communication, but often for children or individuals with limited speech or who are pre-verbal or who have childhood apraxia of speech, speech is not a reliable way for them to communicate, so they will use other behaviors to communicate their message. Now, if that's the case, then we certainly want to acknowledge that message and hopefully teach them a more appropriate or desirable way to communicate that message. And that's more successful for everyone than trying to tell the child or the individual, we don't want to hear what you have to say. So if we just try to eliminate a behavior without providing an alternative, then that can be what we're doing, where we're just saying, we don't want to hear what you have to say. So it can be much more helpful to say, to communicate, we do want to hear what you have to say, but let's work on a different way to communicate that's not harmful or that's more appropriate. Another point just to keep in mind is that the same behavior can communicate different things in different situations. So for example, crying often communicates sadness, but depending on the situation, sometimes it also communicates joy, sometimes it can also communicate anger. So just keep that in mind too, that the same behavior might be being used to communicate different functions depending on the situation. As we're thinking about alternative ways to teach an individual to communicate other than a behavior that's not desirable, we want to think about that other method being consistent, achievable, reliable. For many individuals with childhood apraxia of speech or with limited speech or who are pre-verbal, speech isn't consistent and reliable even if they do have speech. So we want the other method to really be just a very consistent and achievable method for them. So as we're thinking through a given behavior, we want to determine the function or the reason that behavior is happening. And that can really help us to teach a good alternative way to communicate that message. So when you're thinking about what's going on, what's the reason that this behavior is happening, really think about the whole person. So we definitely want to think about physical needs, obviously, hunger, thirst, pain, are there toileting needs? We also want to think about cognitive or intellectual needs. What cognitive demands are being placed on the individual at that moment? Are they feeling frustrated? Do they need more supports? Or are there not enough cognitive demands? Are they feeling frustrated because they're bored? We also really want to think about sensory needs. So is the individual in a ready learning state, meaning that they're neurologically regulated and calm? And for individuals who might be hypersensitive, then they might not be able to be neurologically calm and regulated. If lights, sounds, things like that are really overstimulating, they can even feel painful. Or for individuals that might need more stimulation, they really need more input to really be calm and regulated, able to focus and communicate, or to be comfortable. So we definitely want to be thinking about sensory needs as well. Another really big one we want to be thinking about is social emotional needs. So again, both socially, are we engaged? Are we meeting those social needs, or is the individual lonely? Are they looking for more connection? Thinking about emotional needs, which is a huge one. So what emotions is that individual feeling? and trying to express or communicate. So every person needs to feel seen and heard, and it's been said that nothing is more reinforcing than the feeling of being understood. So just being able to validate in an individual's emotions, and also realizing that many behaviors can be attempts to kind of self-regulate both sensory and emotional needs. So keeping that in mind, that some of these behaviors are really coping mechanisms to help an individual feel calmer, and whether that's because of a sensory difference or because of the emotion that they're feeling. So for example, really trying to control a situation or keep things the same in a routine. Sometimes that is a coping mechanism for anxiety, for feeling very fearful. So in an effort to try to calm oneself, you want to seek out what is very known and familiar. So we want to think about that. So again, thinking through the behavior and what is it that they're trying to communicate. And speech language pathologists often think of this in terms of communicative functions. Now, if you're familiar with ABA, or applied behavior analysis, they also look at behaviors in terms in 4 categories. So we're not talking about that right now. Again, we're taking the viewpoint of communication. So we're really thinking about communicative function, and speech language pathologists think about a lot more than 4 categories. So we'll run through these, and these are also going to be in the handout that it's available. And this isn't an all-inclusive list, but this is definitely some of the most common. So one very common communicative function is requesting. So requesting an item, requesting an action, such as go, requesting a certain person. That's a very common and frequent function. Another one is protesting, refusing, rejecting, avoiding. So saying, no, I don't want this, no, I don't want to do that, don't want to go there, things like that. Another common one is gaining attention, so initiating communication. That's a common communicative function. Another one is labeling, so naming the name of an item. Asking questions or seeking more information is an important communicative function. And then answering questions or providing information is another possible function. Asking for assistance or help is a communicative function. Recurrence, so asking for something to happen again or for there to be more of something, is another possible communicative function. Giving directions is another one. Greetings and social routines, so saying hi in certain situations and saying bye, those are some social routines, and then the communicative function is a greeting or social. Sustaining conversation, so keeping the back and forth turn taking of a conversation going. Expressing feelings, again, this is a huge one, so that's a big communicative function. Sharing experiences, so being able to tell a story or recall information and share it with someone else is another communicative function. Expressing an opinion, whether you like it or don't like it, it's good or bad, is another important communicative function. Commenting, directing attention or showing someone something is yet another communicative function. So again, that's not an all-inclusive list, but it is, we do want to think about, so there certainly could be more communicative functions, but those are just some that we would definitely want to think about when a behavior is occurring. So think about what happened just before the behavior occurred, what was going on, and what do you think that individual was trying to communicate. And that can help in teaching an alternative behavior, alternative way to communicate that message. So when we're talking about AAC, or augmentative and alternative communication, we definitely want to think about using a variety of functions with that communication system. So unfortunately, many AAC users get stuck or are not taught how to move beyond requesting. So requesting is often the first communicative function, and then sometimes it ends up being the only communicative function. So we definitely want to think about, with our AAC users, teaching them other functions, like being able to ask questions, being able to express feelings, being able to maintain conversational turns, things like that. So AAC, Augmentative and Alternative Communication, I'll just say a couple more things about that. I know the SAT B2 Gene Foundation has a great webinar on this topic, But in case you're not familiar, just briefly, AAC is any method that we use in addition to speech to help communicate. So it can include things like naturalistic gestures, sign language, pictures or PECs, communication devices or speech generating devices. Those are some of the systems that are options. And I want us to think about with AAC the importance of modeling, so really teaching how to use that system. We really want to think about using the system that we're encouraging our child or family member to use. So if that's sign language, that we're also signing. If that's a communication device, that we're also using the communication device to really teach that this is another valid, acceptable way to communicate. And just a couple of AAC myths. If you're teaching AAC, you're not giving up on speech. In fact, you're often facilitating the development of speech. Children aren't too young for AAC. If they have those communication prerequisites, then there can be a system that is appropriate for them. And similarly, there aren't cognitive requirements. So again, if the individual is communicating with behavior, then we can very likely find an AAC system that might be a good alternative to some of the behaviors. If you're not familiar, speech-language pathologists generally have a knowledge of AAC, but there are certainly speech-language pathologists that really specialize in AAC. So if your child or loved one doesn't have a communication system or doesn't have a system that you think is a good fit, definitely recommend at least consulting with a speech-language pathologist who really has specialized knowledge and experience with AAC. Let's talk through a few strategies that might be helpful for you as you're working through some of these challenging situations. So the first one is definitely use AAC and use it with a variety of functions. So teach a variety of functions, not just requesting. Model that and help your child or loved one to use their AAC to express a variety of functions. And again, think about the function of the behavior that's happening and teach an alternative way to communicate. Now, certainly that might be AAC, but at times it might be something else, another form like a nonverbal form of communication. So, for example, I frequently work with children, and when they get angry, they express that anger by hitting or throwing. And those are not the most desirable behaviors, so I often teach that instead of hitting or throwing, we can stomp our foot. So, and I teach that by creating situations when the child is not angry, but I am angry, say, and then model that I can say I'm mad, or I can use my AAC to express I'm mad, and I can also stomp my foot and have that very physical way to express that emotion. So ideally, we're teaching that and setting that up in a situation when the child or individual is not themselves angry, so that they're open to learning it. But then when that situation does occur, we can encourage them to then use that behavior that we've already taught and modeled. And then we really want to focus on the behavior we want. So we really want to tell the child or individual what we want them to do, not what we don't want them to do. So for example, if a child was standing on a chair, which was not safe and not something we are wanting to do, then we might be asking them to sit down or telling them to sit down rather than saying don't stand up. And so really, again, keeping language simple and focusing on the behavior that we want. And then we really want to reinforce the behavior we want. So I like how you're sitting in your chair. And we can certainly do that when there's a situation that's arisen where we've directed that, but then it could also occur, again, if there's a behavior that you are trying to decrease the use of, then you might be encouraging the other behaviors that you do want. I like how you're sitting in your chair. I like how you showed me that you were mad. I like, and so I like how you used gentle hands, things like that. Another good strategy is to give choices. So I think we've all experienced, especially in this past year, a lot of things being out of our control and how that can create a lot of anxiety. And so sometimes a coping mechanism in response to that is to really over-control or control what you can. And this can definitely happen for children and individuals with disabilities. So thinking about what choices can we give them so that they can exert more control and feel more control of their environment. Certainly some things are not choices, but can we make choices within that activity? So for example, if brushing our teeth is not a choice, it's an important thing for hygiene and health, but could we have 2 flavors of toothpaste? So we have to brush our teeth at night before we go to bed, but our child or family member can choose the flavor toothpaste, or have more than one toothbrush, and they can choose which toothbrush they want to use at that time. So really thinking through picking your battles, and really selecting what's really important to be those things that we really focus on, and letting the little stuff go, or again giving plenty of choices and letting them make those choices. Something else to keep in mind, another strategy, is avoid asking too many questions. So often with children or individuals who have limited speech or communication, frequent response is to ask lots of questions. But just think about how that feels if someone asks you lots of questions. It can feel aggressive or a bit like an attack. And it's certainly not the best teaching method. So just thinking about making more comments than questions, and I often use the rule of thumb of 3 comments for every question. So just trying to make it more typical of a conversation where we're making more comments and not necessarily asking questions constantly. We certainly want to be acknowledging an individual's communication, even at times when they might be communicating in a way that that's not ideal. But I understand that you're angry. I know that you want this. So definitely, again, acknowledging so they feel seen and heard, even if that doesn't necessarily change the outcome of what's happening. So I know you want this right now, but that's not a choice. But still, again, providing that acknowledgement and validation. And then another strategy is definitely, as I mentioned earlier, helping our child or family member to be in a ready learning state. So that's when they're calm, they're regulated, and they're really able to function at their best. If you haven't been able to kind of figure out some good strategies for that, and we'll put some in the handout and some resources. But definitely the professional to seek is an occupational therapist. They can provide a great deal of information to help you be able to meet your child's sensory needs. And they can sometimes design something called a sensory diet, where throughout the day you're providing the sensory experiences that your child or family member needs to be able to stay calm and regulated. So that can definitely be very helpful. Other just general guidelines to think about with staying in that ready learning state is definitely prioritizing sleep. We all function better when we're well rested. And thinking about routines and movement throughout the day. Routines can be important so that an individual knows what's happening next. Again, not knowing what's happening can be very anxiety provoking. So a desire for sameness and routine can be kind of a compensatory mechanism, just kind of self-calm or self-soothe so we know what's happening. So using visual supports and other supports to really help establish routines and help individuals know what's coming next. And then certainly if there's going to be changes in routines, preparing your child or individual for that in advance. And again, using visual supports, and the bigger the change, the farther in advance you want to start preparing them for that difference or change. So those were a few strategies that I hope will help you to think about behavior in a different way, really think about behavior as communication, think through those communicative functions, think about the whole person. What are they trying to communicate, and what would be a good alternative way that they could communicate that need, want, desire, whatever it might be. We're going to provide a handout that has a variety of resources more about childhood apraxia of speech, more about behavior, more about validating emotions and how we can do that for our loved ones. And also some links to some things of just specific routines and how we can hopefully move through those routines with greater ease, maybe some routines that can be challenging. Thanks for listening in, and we'll be providing another webinar soon where we will talk about literacy for children with complex communication needs. Thank you.